Thank you. Okay. So good afternoon, everyone. Thank you so much for joining. My name is Mariah Washington. I'm the Director of Community Engagement at New York City Emergency Management, formerly known as OEM. So often you all say OEM, we say NYC, we're talking about the same group. I'm super excited to talk to you about a program that we have been able to pioneer in these past 2 years. And so I'm going to take you on the journey of the foundation that was laid for us to establish this program called Strengthening Communities. And then I'll also do a teaser at the end. We have information sessions coming up. We are trying to onboard 20 new networks. We currently have 16 networks throughout the 5 boroughs. And so we are trying to get a little bit stronger with that. And with me in the back, I have 2 of my teammates. I have Emily and I have Sanaka, and we are collectively part of the community preparedness team. So that means that we work with community and faith-based organizations, small congregations, and networks, or you might call them coalitions. Okay. So before I jump in, we never want to make any assumptions. We want to make sure that you know what is emergency management, New York City emergency management. And so for you to know, we are a group of folks who are made up of about 250 people. Most of us are coming from various professional backgrounds. We have folks deployed from the police department. We have folks deployed from the fire department. We have folks deployed from DCAS. We have folks deployed from different agencies who have been working with us for 10 years, 6 years, 5 years, or less. And collectively, our goal is to help New Yorkers before, during, and after emergencies. It's important for you to know that we are the liaison agency. And what that means is when an emergency happens, there's actually an emergency protocol that happens, there's plans, but we are the person that makes sure everyone plays nice in the sandbox, right? So oftentimes people see emergency management and they think that we do it all. And so they'll see, oh, that's New York emergency management. Let's ask them about this policy. Let's tell them they need to do this. And we only get to do the coordination to make sure all the other agencies are stepping in and stepping up for said emergency. So if it's a big blast, the lead agency will be the fire department, right? If it's something that is around a terrorist attack, the lead agency will be the police department. But there's still all these other entities that are working to help New Yorkers collect. We do the preparedness, we do the response, we do the recovery. There are dozens of people in the office who I don't know their names or faces because we've been in this real virtual hybrid world who make plans. That is their role as an emergency manager. They create plans for any type of all hazard. They create plans for the actual man-made disasters. They create plans for the, hey, there's a winter weather related emergency. So when we say the word emergency, it's any type of weather related, pandemic related, or man-made emergency. We are made up in Community Engagement Bureau. We have 3 teams that I want you to know about before we dive in deeper. We have our CERT team, and that CERT stands for Community Emergency Response Team. That's our volunteer program for New Yorkers who are 18 years and older. They do a very quick background check. You go through a basic training that is now hybrid, so you can do the majority of it online. And then those last 2 weeks, you come in person for a couple of hours. What this allows you to do is 2 really cool things. The first is you get to help promote the culture of preparedness. So you get to, as a CERT member, facilitate the Ready New York preparedness. Here's how you prepare for emergency. Here's the 3 steps. The other great thing is that they are support to the first responders. So they might be actually at the site of a service center, helping greet people who just experienced a terrible emergency. They might be human arrows. They might be out there with the police department helping direct traffic. But they receive all the disaster preparedness training up front. They work in cohorts based on the community board districts, and they do preparedness, and they also do the response piece as well. You have Ready New York. Ready New York, we go to any and every crevice of New York City that we are invited to, and we provide a presentation to take New Yorkers through a 3-step process. Make a plan, gather supplies, AKA go bag, and stay connected with Notify NYC. That make the plan process is very, you hear the word plan and you're gonna go somewhere very deep. We're taking a step back. Making a plan is as simple as establishing who are you gonna call when there's an emergency? What's an alternative place, if you do have one, that you can go to if you need to evacuate? If there's a gas main break, or a water main break and you are just out of commission of your home, you're gonna grab your bag and go if you're in the building when it happens. But is there someone within your personal network that you can reach out to? Making copies of documentation. What's the hardest thing that it is to prove when an emergency happens is, unfortunately, it's hard to prove who you are. So it's important to have copies of your passport, your government issued IDs. Some people copy their lease because we have some complicated matters where folks will say, oh, no, you don't rent from me. And it's like, I have a copy of my lease. So these are things that we encourage you to make copies of, but also to put in the go bag. That go bag is going to sustain you for 2 to 3 days. You're going to put a couple of outfits in there, some clean underwear, some wipes, a couple of prescriptions. If you're like, oh, I can't get them that far in advance, throw your old bottles in there so that if you are stuck where you can't go back home for a while and you can't access your original pharmacy for whatever reason, you have proof of like, here is the prescription, here's the doctor's names, here's how many refills you have. I'm not going to do that whole presentation, even though I kind of just did it in 35 seconds. We do that in 45 minutes. We do that in 30 minutes. We do it in an hour and a half. We work with older adults. So we go to older adult centers, clubs. We work with kids, children. We have Ready Girl, who is our Marvel superhero, who helps explain preparedness to children. Because we don't want people to be scared. We want them to be prepared. And part of being prepared is knowing. Right, they already unfortunately do fire drills. Now they do active shooter drills. Things that when I was in school, we only did fire drill and earthquake drill. In tornado, we never did an active shooter drill when I grew up. And so now they're doing all these drills. We want you to know when you have a plan at home, your mom, your dad, your auntie, your uncle, your grandparent, your guardian, you need to practice that plan as well. So, okay, practice grabbing your go bag. Okay, where are we going to meet? Our meetup spot is fill in the blank. So we do this for people with disabilities, access to functional needs. That's what DACA stands for. We do this for immigrants. We do this for anybody that speaks another language. You might say, I want you to come, but Wolof is the language that is spoken. Wolof from Gambia, because there's 2 different Wolofs. And that's so specific. And guess what? We still get to serve them because we have an interpreter that comes in. Part of that DACA piece, I'm going to tie it into Sandy, is you may or may not know that New York City got sued by the disability community. The advocates and people with disabilities, they got together and they body slammed New York City government because during and after Sandy, there was no type of accommodations made for people with disabilities, access or functional needs. And so the gift that came out of that is we now have DACA specialists in different divisions throughout emergency management, throughout Department of Health, throughout the different mayor office. And that is their goal. Their goal is say, wait a minute, Mariah, before you all do this, is it accessible? Did you use that checklist to make sure the space is accessible? Did you send out clarification to see if anybody needs closed captioning, whatever it may be? So that was I call it a gift because it made us better. It wasn't a gift because people who were impacted had a horrible time, but that held the city accountable to step up significantly and to incorporate disability access to functional needs in our plans and our preparedness education outreach and all that we do. So that's a little tidbit. And then my pride and joy is the community preparedness program. That's the one I get to lead. And that's the one where we get to engage with community faith leaders throughout New York City. We provide a lot of seasonal webinars. So we do coastal storm webinars. What steps can leaders take during coastal storm season, during extreme heat? How to check on your neighbors, how to encourage people to create a phone system, old school style, a knocking on the door, like, is your air conditioner working? You can come to this person's apartment until your air conditioner is working, because what's happening is our older population particularly, and our vulnerable folks who air conditioners are just dying, is that they're like, oh, I've always sat with the fan and just fanned myself. But heat is the #1 cause of death amongst weather-related emergencies. And so we push so hard this summer, like, hey, we need you to not use your fan. Air conditioning saves lives. We also do extreme winter weather because there could be a blackout, a brownout, or you might just be snowed in, how to stay in place, how to help your leaders and the people that you serve. So this is a variety of everything that we do. And we get to work with 3 different types of populations, but kind of the same. So I'm saying hyper-local, community-based organizations, hyper-local, faith-based organizations and congregations, and then community and faith-based networks. So when we say hyper-local, we're really talking about those grassroots, on the ground organizations that might not even have the 501c3 tax code because for whatever reason, they might have been around. We're Mothers on the Move. We're in Hunts Point. We've done housing advocacy for years. This is what we do. We can get a fiscal sponsor, but we're not a 501c3. We're a group of women who do amazing work, and we want to be part of this work. So we're not targeting, you know, the different organizations that have multiple sites all across the nation. That's not our target population. It's actual local community groups who are doing the work, who have their sleeves rolled up, who are in their communities actively. We let them define the word community. So if they're like, okay, I'm in Morrisania, Bronx, I'm not going to tell them, okay, well, your community is defined from this zip code to that zip code. Instead, I ask, well, what is your target population? If they tell me community ward 3, that's what we'll honor. So when they create different tools and strategies, that's what their focal point is. And for the community faith-based networks, that is the focal point of a lot of the work that we're doing right now. And so those are the coalitions. Those are the groups that are already clustered around housing advocacy, and it may be made of 12 different member organizations, but they call themselves Better Housing Network. But they're made up of all of us right here are different member organizations. And so part of why we're putting our eggs in the basket with working with the networks is because we know that the ripple effect is going to be a lot more stronger and wider by working with a network with 15 organizations versus only getting to work with one organization that has this little spread piece. I don't know if they can see me on camera. They can see me on camera. So that's who we serve. That's who we collaborate with. Part of our establishment, when we established our programming tools and who and how we want to do the work, we really leaned on Dr. Daniel Aldrich, who's done some really great research, especially post-Katrina. I don't know if he's still at Northeastern, but he also does work in Japan as well, post the tsunami and some preparedness components. But he uses a great word in terms of community resiliency, and he links it to the different types of social capital that exists and the importance of it. So in the work that we do, we strive to make sure that we're linking those 3 different components. So for those who may not be able to read it right now, the collective ability of a neighborhood or geographically defined area to deal with stressors and resume life through cooperation following the shocks. So the image that comes to mind is, you know, there used to be a inflatable clown that you would blow up, and if you punch it, it bounces back. That's the cartoony image I have when you think of that resilience after emergency. Consider that punch, that's the shock, that's the emergency, and that bounce back, while I would love for our bounce back to be rapid, our bounce back will be a little bit slow because some of the air got fizzled out. So we got to get some more air in us, and then we get back to that place. But the social capital piece is where we come in. So the bonding is, okay, great. It's me, my 3 friends, and hey, we're part of the National Council of Negro Women, and we're an amazing, great group of Black women, and we're doing great work. Okay, that's bonding. How are we bridging? Okay, we're working with this synagogue, we're working with this mosque. Okay, so now we're starting to connect with other people beyond what's comfortable to me. And then the linking part is the part where a lot of the different conversations that's happened early this morning is about. The linking is where community members, community organizers, leaders link with government, so that when that emergency happens, it's not a, hey, I'm Mariah, I'm from emergency management. Instead of like, oh my gosh, Mariah, it's so good to see you. I can't believe what just happened. That, oh my gosh, Mariah reaction is because we established a link and connection. We established a relationship. So much of our work is rooted in relationship. One of our fan favorites, Jill Cornell, is not here today, but giving her a shout out because she helped birth a lot of the programming that we did, specifically as it pertains to this community emergency planning toolkit. So when Sandy came in 2012, we got hit. We got the call to action at the time. Former Mayor Bill de Blasio was a public advocate. He did a lot of reports like a lot of elected officials do. We read the report, but we also were placed on the fire. And part of that was, a lot of expressions there, was, hey, there's a disconnect between government, community-based organizations, and faith-based organizations. We need to get together. You all need to have conversations. We suck, pretty much. So it was like, okay, well, we gotta figure this out. What does that look and feel like? And so with that, it was a collaboration where some of the New York City Emergency Management staff, Department of Health, Mayor's Office, and different community partners all sat at a table together and just shared their ideas. And from that, birthed our community emergency planning toolkit. The goal, the target population for this toolkit was the networker coalition. It was like, hey, if we are in South Bronx, we already have 10 different organizations in Casita Maria who work together. We're going to develop a community emergency plan together. What does that look and feel like? We updated it again in 2015. And now when we use it, we go through that cycle of the emergency cycle, which I don't know has been shared with any of you today, where it starts with preparedness, right? Or you might say, no, Mariah, it starts with mitigation. Okay, we could thumb wrestle either one. It's still a cycle, so we get to it. We'll start with preparedness. So that's the educational piece of, I know how to make a plan. Now that my household has got it together, I can think about the whole community instead. And so there's that possibility as well. Oh, no problem. It's good. Yeah, don't be trouble. So we have our cycles of preparedness. Then we have that piece of response. When we get our networks together and the organizations together, I always tell them, we always tell them, we do not want you to be first responders. That's not why we're doing workshops, training, and planning. We know that you will be first on scene after the professionals step in and assess the situation. But by you coming up and saying, hey, by the way, Wolof is spoken in this building, and only 5 of the 60 apartments speak English, then we know, we need to go get a Wolof interpreter, and we need to get some translation together with the resource guide, so we don't be so reactive. So that is part of why we work together with networks and organizations, is that we have to react to that, we have to respond to the emergency, but we try not to be reactive, because when you're reactive is when you forget about the plan. So when you respond, it's like, I have a plan, wait, we got a little off track, okay, let me straighten up, okay, we're good. That recovery piece is the return back to the new normal. It's not the normal, because the normal has, we think about COVID, the normal is gone. The new normal is here right now, and we are doing pretty decent, all things considered. And then there's that mitigation piece. We try to focus with our community partners of like, what are some actionable steps that you can take to mitigate certain types of emergencies? Some emergencies, they can't mitigate. It's really something that we need to do as government or private with the big money that they need to do. But we try not to finger point, because again, we are the liaison to make sure that everyone plays nice in the sandbox. And regardless, our goal is to help New Yorkers before, during, and after the emergencies. So within the toolkit, we broke it down into 3 different sections. Before the emergency, after the emergency, putting your plan to action, and then we had listed all these cool resources. So in that, we highlighted a couple of East Harlem COLAG, Red Hood Initiative, like here's some great work that community partners are doing on the ground in terms of communication during the emergency. What's a map? What's a community map and a resource guide? Why is it important? Oh, like how do you manage the donations and volunteers? Like this happening right here in the community. We as government, not elected officials, we're gonna say cash is best. We don't want to collect clothes. We don't want you to collect clothes because space is an issue. Even with the fires that happened in the Bronx in January, we had tons of clothes that had to get discarded because people donated prom dresses, people donated summer clothes. People have great intentions, but great intentions don't land on what the needs are. So we try to encourage networks to really create and establish a plan as it pertains to how you're going to manage donations and volunteers. Spontaneous and wanted, because you get people, I watched someone drive, they came up from Westchester, they had all these cases of water and diapers, and I watched the organization struggle with saying no, because they had just engaged with the family who needed diapers, but if you looked at their storefront, stuff was already stacked up, you know, a good 10 feet high. And so that's another fire hazard. So there's these struggles that exist that we try to create at ease. Now, it used to be, we would say, all right, we're gonna do a toolkit, a boot camp. We're gonna meet with you 2 days for 3 hours, and we're gonna guide you through this very quickly, what is in this toolkit. We did good with it. We got excitement. Jill and I were standing on the soapbox, and yes, let's go get them. Everybody's like, this is great. Then 2 months later, hey, how's it going? Yeah, we don't have the capacity. We don't have money. We don't have resources to do it. It's a great idea, but that's not our priority, and we can't do it. And so we were kind of get a little depleted, but not defeated. Like we stayed in there, we hung in there, and COVID helped us become a game changer in terms of we started doing webinars on Zoom and webcast instead of this Adobe feature. So it opened up to be more accessible. It allowed folks at the time before Zoom fatigue existed. We used to get lots of folks joining in, eagerly taking the information and then trickling it back to the community. So what we've done is we broke it down. So in the middle is the 4 different deliverables that have been created within strengthening communities that came from the toolkit. So we said, okay, I'm gonna do 4 modules. Mapping and resource guide, that's 1 module. A needs assessment, that's another module. Having a communication plan, so having some scripts of like, hey, we just experienced a power outage. We don't know when it's coming on. Please stay in place until further notice. We're going to send that and notify NYC, but we want our partners to send that out to their own community members as well in the languages that are necessary. And then again, I mentioned the managing donations volunteers. And ultimately, with all of these planning modules in the middle, they create a community emergency. And so before I move on, you see that I put some special community preparedness trainings as well. We do how to plan for multiple emergencies. So during COVID response, we saw that a lot of organizations and coalitions were responding to COVID and food insecurity. They're responding to multiple things. And so how are you prioritizing this? How are you establishing a plan on documentation so that if the leader is plucked out, everything's still running? The continuity is flowing versus getting bottlenecked or just stopped. And then organizational preparedness is like a continuity plan, but we just say it's a way to get your small organization or small congregation prepared for emergencies. So we do this in the form of training. We do this in the form of workshops. We do this in the form of providing technical assistance. So after we do that workshop, if that community partner says, hey, can you sit with us for another 5 hours? We'll say, okay, let's put 3 days on the calendar and let's work it out from there. And we'll sit with them and talk to them. What is your true need and what can we establish with them? Our goal is never for them to just fill out this document. We want them to truly work together with the other member organizations in order to establish a product that is a living document, but serves them well in the community that we serve. And then we do the community and team development. So that's by us participating in meetings and not trying to get on agendas, but just being ever present. Yesterday, we got to go to Coney Island to the beautification project that they had for the 10th commemorative service project. And they were so ever grateful. We were ecstatic just to get invited, but they was, thank you so much for coming. Thank you so much for coming. But so much of that linkage between community and government is really about showing up before the emergency so that when the emergency comes, guess what's there? The trust is there. The knowing of, okay, we know Mariah's team, they're going to advocate for us. But I'm still going to give her an earful because I want her to know X, Y, and Z. And that's what we're here for. We want to be that connection so that we can trickle it up to our executives as well. We do something called Unity in Community. So that happens every other month. And that's the opportunity to engage any and every organization and faith-based group and coalition that wants to kind of hear what's up. We might have a topic around extreme heat. We'll have a community partner share some best practices that they do in their response and their preparedness. And then we might have a government official say a couple of things and or not. And then we open the floor up for other people who might have questions or for people who might just want to share additional best practices. We send out a weekly newsletter every Wednesday for the most part, sharing out emergency preparedness tips, sharing out upcoming events, which you'll get some information very soon. And we just try to partner, participate, and collaborate with our partners. So if they invite us out, what do you need to bring? We'll bring it. Or hey, can we also do this? Great, we'll be there. And we show up. So that's our way of communicating. But all of this is for these reasons. We want that two-way communication to exist. We want it not to be one way where, oh, we send something on notify NYC, go do it. We want it to be when I'm in the emergency operations center, and that's where all of the entities are working together in city government, that's the sandbox. The emergency operations center is the sandbox. We want that our partners are saying, by the way, Mariah, did you know that we actually have 15 households that still don't have water, although the other ones do? I didn't know that because they told us that it was done. It hasn't been. Great. I get to now in my emergency support function, I get to trickle that up, over, and around to ensure that that issue is addressed. So that's the biggest, outside of the culture of preparedness. That other big win is that we have that two-way communication and that we're integrating them and that they're trusted messengers for us and vice versa. When we come with information, they know that I'm not just giving them a script because I was told to, but like, okay, they give it some thought, or that's all they can give us right now. That's why she's saying what she's saying. And we strive to advocate the community's needs. And when we struggle with this, when I struggle with this, I create a three-way conversation with my executive and my community partner and say, hey, I just want to have a check-in with this partner because there's some concerns I think you should hear. And so they're not blindsided, and then allow my executive to hear directly from the community partner. So this happened for the arsenic scare that happened in Lower East Side Village, where the water was contaminated. Excuse me, the water was perceived to be contaminated. It wasn't contaminated, it was a false positive, but everyone thought arsenic was in the water. And so all of a sudden we jump in, we're pushing out all of these cases of water. One of our networks was on the ground and they were helping hand out the flyers and helping do the physical labor, going up and down the stairs and just helping. And so I'm like, hey, tell me what else is going on, because some of the government entities are saying this, and that doesn't sound like what you all do. So we got to clear it all up and still advocate for the community, but also for our partners. And that's what we want to take care of the relationships that we have. What time is it? 2. Oh, snap. Okay. Speed through. Okay, so we do all this. I'm building it up. I said this already. And this is our program. And then I'll dive in a little bit deeper.
Emergencies happen. That's why New York City offers the Strengthening Communities program. It's open to local networks with strong community connections. Our experts help your network build a community emergency plan. Your network is paid as it completes each step. Apply now because it pays to be prepared.
All right, so strengthening communities is what you're here for. I had to build that foundation for you to know that this wasn't a pie in the sky idea. This was something that we were crescendoing to. So I mentioned to you that when we were doing the boot camps, 2 months later, things were flatlined because we didn't have resources to keep them going. So for emergency management nationally in our country, when emergencies happen, it unlocks the golden chest of gold. Like the millions of dollars all of a sudden are here because that emergency happened. And so what happened for us was that there was some COVID response funding that came unlocked. Heather wrote a grant that included some resilience work and also community work. And we said, hey, we already have this broken into modules. What does it look like for us to finally actually be able to compensate our networks in doing the work that we've been trying to do and they got excited about, but they didn't do yet. So the goals are to deepen community preparedness. It's for them to have their own community emergency plan in a framework, and for them to understand the importance of the role that they play for emergency. I often say I'm not converting you to be emergency managers. I don't want you to be an emergency manager. I want you to be the great leader in the community that you are. And I just want to add some things to your backpack of tools and resources. We tap into these people who are already active in communities. It's like we just nudge them like, hey, you're already doing this great youth development work. You already responded to COVID, so I know you can respond to emergencies. What does it look and feel like for us to capture what's in your mind, put it on paper, and share it with your teammates so that everyone else can have a hand in it? And so we do that. I mentioned we do coaching, so we do a training, we do coaching, they submit deliverables. And so here are the deliverables that we have them submit. A needs assessment, we do the training, they do the coaching, they submit the deliverable, they get paid. Community map and resource directory, they do it, they get paid. the communication strategies, written scripts, they do it. Donations, volunteers, they do it, the framework. Now we put ×2 in there. Excuse me, because we really want them to find a consultant, but an organizer that's within their organization that they can pay. So we say, hey, we're gonna give you a total of $40,000. We think half of it should go to the consultant that's doing this work, and the consultant can't be an external person. It needs to be someone within your community that's already connected to your network. We also realized after our first year that it wasn't equitable for us to tell them how to use their money. So we just said, hey, we're giving your network $40,000, and how you choose to use it is to your discretion. And so that was the cool thing that we're able to do. Here are the steps that we take, the training, the coaching, the deliverable submitted. We review it as a team. We provide feedback for these to be living documents, and then they submit the invoice and we get the money. You might wonder, after the first year of establishing a plan, what happens next? The next is that we hold them to the fire to start doing the preparedness events in their communities, to have workshops, to socialize their plans with other people in their network, so that they're not hoarders of information, but truly like integrating it throughout. And for them to also begin to do what we're rolling out very soon is our community canvassing. So we're unlocking a protocol that will allow us to compensate networks to do canvassing. Their canvassing to be in the form of door-to-door, people-to-people, text, social media, and/or phone calls. So we're establishing a price chart for those things so that when we say, hey, there's this storm coming, we need help, or there's this level 2 emergency that's specific to your community, are you able to canvass? We're going to allow them to opt in or opt out. If they opt in, we let them know the information that we need to be shared. We let them know how much we're going to be able to compensate them, and we go from there. And you can't see this, but this is just a list of the 16 networks we have. So we have Academy of Medical Public Health and Services in Brooklyn. We have Entertainers for Education, which does youth development work in Brooklyn as well. We also do Far Rockaway Aber Nonprofit Coalition, Haitian American Alliance of New York, Mothers on the Move, they're in the Bronx, Project Hospitality, they're in Staten Island, South Bronx Emergency Network, they're in the Bronx, Southeast Queens, Emergency Network for Arts and Culture, they're in Queens, they're made of a cluster of museums. Harlem Emergency Network, they're also in Manhattan. Cohort 2, we have the Neighborhood Housing Services of Queens, CDC, we have the Fifth Avenue Committee, and we have our very own Miss Sabine in the house, who's a cohort member. So if you have questions from her, you can ask her too. We have Staten Island COAD. So COAD stands for Community Organizations Active in Disasters. So there are existing networks and coalitions that their function is only for emergency. We don't target just those groups. Instead, we say, oh, we're changing Far Rockaway, their community emergency network. In our terminology, because they have their own initiatives. They're doing job readiness, they're doing youth development, they're doing social emotional development, and they're doing emergency preparedness. The Point CDC, which is in the Bronx, and the Jewish Community Council of Greater Coney Island, which is in Southern Brooklyn COAD, and then Lower East Side Ready is also in Manhattan, and then Rema for Us, that is a merchant group that is located in Queens. So we're made up of a lot of things, a lot of different groups. They all have different missions and visions. These are existing networks who have existing member organizations. They have more than one. They have like at least 3 to 4 to 5. They have amazing connections throughout their community, and then they have a commitment to serve and develop. So I will stop here for questions. Some of you are in your communities. We currently are going to be rolling out an application to onboard 20 additional networks. I could really use your help. I know we just met today. If you could take a picture of this information and share it with your congregation or a group that you're a part of, it would mean a lot to us. We really want to get the word out. We're going to have an information session where it won't be like this. There will be a lot more time for you to ask questions. But please take a picture of this, and then I'll pass the floor if you have any questions or curiosity.
So that was quite the first. You said for the older people that he's doing this on very interesting. So when helping them out, do you like create like a space for them to go, or just give a $2?
So for the city government provides cooling centers, right? The cooling centers locations, though, there's scarcity. There's some places, some communities where it takes 2 or 3 bus rides to get to the place. So what we find is a lot of our community partners, if they have a physical location, they eat out of the goodness of their own hearts. They'll open up their space to be a cooling center, but they won't call it. They'll just say, come hang out. We have air conditioning, we're providing a meal, we can play some games. So they create that space. So it doesn't feel like I'm babysitting you, but it feels like come socialize and stay cool.
I have a question about the community resource map.
Okay.
Once it's created, how are they distributed and what kind of, is it like a big packet or is it like the big usually like that's like what does that look like?
So the community resource maps that they create, we're not partnered with Google, but we do have them use MyMap. We've seen an 86-year-old do it and a 21-year-old do it, right? Because we give the basic, like, here's the how. They are the owners of all these tools. They share the links with us, they share the tools. I've received resource guides that are 5 pages and then another one that's like 60 pages, right? Because some people are creative and very detailed. And because some people are like, oh, we're gonna keep ours in the cloud. And I'm like, you can't push links on a printout paper. So put a little blurb. So they look and feel different, but we encourage them to use that resource guide for when the emergency happens. You can go through and say, okay, wait, who do we actually have connections with? And are they still able to function? Oh, no, then that's a big need that we have. So we have them utilize that tool to assess their needs, but also to assess after the emergency, what resources are actually available.
When it's really big college, do all of them exist somewhere together or where we can find them?
They're not public.
Oh,
They do exist. I have them and I share them. I share a screen with people, but I have them in public.
I don't reside in New York or in the US.
Okay.
I'm just visiting. But I was curious about the model and possibly, replication. I'm from the Caribbean, so I'm very interested in that. I'm wondering about accountability. If I understand, I came into the presentation, I didn't see everything. If there is supposed to be locally based CDOs or FBOs or so that is coming up to deal with this, and funds are being dispersed, I believe it will be public funds, and it's disaster management for preparedness, so we can only really see or evaluate their work post a disaster. So, how do you ensure that there is some degree of accountability and some kind of quality assurance check on this?
So for year 1, the accountability is very easy because for every deliverable that they submit, they're getting paid afterwards. But we just don't approve it. There's been times where we send back and say, hey, this is a good start for a map, but this won't serve you or your team well. We need you to go back and really reassess what's available. So for the first year of the actual developing community emergency plan, the accountability is there. For the sustainment year, when we say, okay, you need to do 3 preparedness, I think we said 3 preparedness events between February and June 30th. They have to submit the dates to us and we pop by it, or we just ask for pictures. So for us, we're building a system of trust, but we're also making sure that we establish deliverables that we are able to measure to some degree. So I'm not going to keep it ambiguous, but how they use their money, they have never gotten money up front. We have never given them money up front. We don't have that ability to do that based on the systems of New York City government. So we never give them money and say, I gave you this, you didn't do it. So we always, that's the way that we're able to filter it right now.
Thanks.
I participated in cohort number 2, and I didn't realize that, like, looking back on it now, I'm just curious about the intentionality in making the cohort like as diverse as possible across like the boroughs of NYC. Like, is part of is that part of how you're building out these cohorts?
So the first cohort 1 and 2, what we used was the city started a task force for racial equity and inclusion, and we call it TREE. And so we targeted the TREE neighborhoods. They chose these neighborhoods based off of, wow, these communities got slammed by COVID-19. Let's pump in some resources. Here's how we can do it. So for cohort 1 and 2, we did target the TREE neighborhoods and a little bit of the IDA communities. But for cohort 3, We're looking for any and everybody. It's open to any coalition in New York City.
Okay, and then my follow-up question is, I noticed that Staten Island wasn't in those cohorts, so it's. Alright. Okay, then, yeah, that, the Staten Island cohort,
Mhm.
okay.
And Project Hospitality. on the
Okay.
cohort one.
Okay.
Well, I guess, I don't know if silence is boredom, exhaustion, or I don't know. I don't know. And there's no questions online. I was gonna play another video of some of our partners speaking, but I won't do that. And that will conclude. If you don't have any other questions, we'll stop there.